What if you go to the doctor and they completely dismiss you or say something mean? Or what if you feel fine and they find something terrifying? Or worse, what if you feel like something is wrong and they tell you they can't find anything at all? If that spiral sounds familiar, you're not alone. I'm Dr. Goodwin, a family medicine physician, and I have still cried before doctor's appointments and tried to avoid them as much as possible. Not because of physical pain, but because I was terrified that I wouldn't be believed. Today, I want to talk about appointment anxiety, what it really is, why your brain is not messing with you, and what helped me finally start showing up for medical care again. Let's explore where this fear comes from and why your brain is doing exactly what it's supposed to do. Let's be clear. Avoiding the doctor is not about being lazy or irresponsible. It's often your nervous system trying to protect you, especially if you've ever been dismissed or gaslit or been made to feel like you were a problem instead of a person. When I moved to California during the COVID pandemic, I had to find a new endocrinologist. I was terrified that she would tell me that my Addison's disease wasn't actually true. And that fear wasn't completely irrational. It had already happened to me before. I had had an anesthesiologist in the hospital walk up to me and tell me that I was completely making it up. So when my new doctor very calmly looked at my labs and said, "Of course you have Addison's disease. What are you talking about?" I broke down and cried because that's what validation does. It calms a nervous system that's been bracing for harm. Avoiding medical appointments isn't just about fear of needles or fear of bad news. Oftentimes, it's rooted in our brain's protective mechanisms responding to past experiences, specifically the limbic system, which has structures like the amygdala and the hippocampus. They play a pivotal role in processing emotions and memories. The amygdala is deep inside the center of the brain, and its main job is to detect threats and initiate a fear response. So, when someone has experienced medical trauma or dismissal, the amygdala can become hypersensitive, which means it can react even to neutral or safe medical environments. Something like being in the exam room or seeing someone wearing a white coat can trigger fear, even if there's nothing inherently dangerous going on in the moment because of previous experiences. This heightened state of alertness is the brain's way of trying to keep you safe from perceived threats. It's a phenomenon that's sometimes referred to as an amygdala hijack. Research supports this. There was a study published in the Journal of Neuroscience that found that individuals who had more anxiety had increased amygdala activation, even if they were exposed to completely neutral stimulus, suggesting that there is a much lower threshold for threat detection if you've been threatened in the past, which makes a lot of sense. When it comes to doctor's appointments, this means that past negative experiences can make future medical encounters seem threatening, even if objectively speaking, they're not. Even more so, the brain's pattern recognition system, which is designed to quickly identify and respond to dangers, can misinterpret cues based on past traumas. For instance, a doctor coming in and saying hello with a neutral tone, maybe holding a clipboard, can unconsciously trigger memories of a previous negative experience, or sometimes even just an experience that you've seen of a family member or a friend, doesn't even have to be your own, can lead to heightened anxiety or a desire to leave or even run out of the room screaming. Because this is how your brain works. Your feelings are completely justified and normal. Not only that, but your anxiety response is a testament to your brain's protective mechanisms working exactly how they are supposed to be. Your brain is trying to protect you. It's just like having an overprotective friend who remembers every difficult experience and is trying to shield you from potential harm. Understanding this biological basis isn't going to make the anxiety go away, but it can help you transform any judgment you may have for yourself into self-compassion. We start looking at how can we help our overprotective friend, our brain's protective mechanism, calm down a little bit more and recognize that they don't need to act like a helicopter parent. So once I stopped judging my fear, I could finally start asking, what would make me feel safe enough to try again? So Here's what I always do, and what I highly recommend all of my patients do. Bring your records with you on paper. Carrying your lab results or your imaging reports can give you something objective to stand on, and it shifts the focus from, I'm going to have to try to convince them to believe me, to, I have the proof right here, and we can collaborate around what we can both see. If you don't have all your records in one place, I highly recommend starting with a basic medical history summary. It can give you clarity and help your doctor quickly understand your case, the concerns that you have, and help find resolution for you and your symptoms faster. If you want, you can download my free medical history template that I have at drgoodwinmd.com, and I'll put a link in the description. The second thing you can do is take someone with you. I always bring my husband with me whenever he is available, not only to speak for me, because sometimes he can provide a really good perspective, but also to be a source of calm and reassurance in the room. Sometimes, even if I take notes, he will hear something in a slightly different perspective with a slightly different worldview that will bring up questions that I wouldn't have even thought about. And so I really appreciate having him there with me. And third, use grounding tools. Like I talked about in my last video, I love to practice deep breathing. And I remind myself, I know that my doctor cares because I care about my patients. Almost all of us went into medicine because we wanted to help people. We have absolutely no desire to harm anyone. I also like to reframe the experience. Instead of asking, what if they dismiss me? Or what if they tell me nothing's wrong? Or what if they tell me there's nothing they can do about it? I try to ask myself, what if they can help me? What if this is the beginning of feeling better? What if this is going to go really well? And reframing things in a more positive mindset doesn't necessarily help the appointment or the outcome of the appointment, but it also can, because when I go into the appointment with a calmer mind, feeling more confident and more positive about the appointment, the more likely I am actually going to be able to present what's going on with me in a clear and accurate way to get the help that I actually need. And then lastly, acknowledge the effort that you're making to go through this at all. Whenever I see anxious patients who come to see me in the office, I try to make a point to say, thank you so much for coming in to see me today at all. I know that this isn't easy. I am so glad that you're here, and I want to help you work through whatever problems you're having. You can say that to yourself too. You can acknowledge how incredibly difficult it can be to reach out for help from a system that's unfortunately not working as well as we would like it to. And if you've ever wondered what your doctor is really thinking if you walk in visibly anxious, I want you to know that we do see it and we do care. As a physician who's also a patient, I noticed that once I started looking for signs that people were anxious in the exam room, I realized that most patients aren't necessarily overreacting. They're just really overwhelmed. So anxiety shows up with people coming in with color-coded binders full of notes and notebooks just filled with pages and pages of handwritten information of them trying to figure out what's going on. Some of my patients would really minimize their symptoms so that they didn't feel like they were a burden to me, or because they didn't feel like I was going to be able to help them, so they didn't want to go through all the trouble of explaining it. Or other of my patients would shut down really quickly. They'd get really quiet, kind of stop answering my questions, or sometimes they would get really defensive and start arguing with me about their symptoms. And sometimes fear comes out as frustration. It can come out as lashing out a little bit and saying, well, I don't think you're actually here to help me, or I don't think you really care, and you're just brainwashed by the pharmaceutical companies. I've heard that so many times, and it's not true. None of those reactions mean that someone is being difficult. It means that someone is doing their best while they're feeling scared. And when I see that, I work so hard not to judge, not to get angry, not to get frustrated back or argue. I slow down. Because the most healing thing that I can offer in those moments isn't a diagnosis or a prescription or a list of things that they should or shouldn't do. It's just being present. It's just being there with someone and saying, you are safe here. You can talk about your concerns here. I want to help you. And so oftentimes I find myself saying to my patients, we can figure this out together. You don't have to explain this perfectly, and you deserve to get answers. Let's figure this out together. So if no one's ever said that to you before, please let it start here. Let it hit your heart, because I mean it. You are worthy of care, not just because you're a patient, but because you are a person. You deserve care that makes you feel safe. So if you've been putting off care, not because you don't want to feel better, but because you're scared that you won't be heard, I see you, truly. That doesn't mean you're broken. It means your body is doing exactly what it was designed to do, try to protect you from pain. But you can create a space that's safe enough for you to try again. So start gently. Book the appointment. Bring a friend, print your records, take a deep breath. It's okay if your hands are shaky. If you're showing up, it counts. And if you want help preparing for that first brave step, I made a video for you where I walk through how to do a 5-minute ritual that will help calm your nervous system when it's feeling anxious and tell your overprotective friend, the amygdala, that they don't need to hover over you and make you feel so scared. Watch that next. And if this video helped you feel seen, please subscribe. You never know who else is sitting quietly in the waiting room feeling scared, wondering if it's just them. Send this to them. Let them know they're not alone, because you deserve care that meets you with compassion, not confusion, and with safety, not with shame.